Welcome to the channel. Today we're tackling a critical issue that affects us all, yet disproportionately burdens the most vulnerable among us: the public health crisis. It's a complex problem, deeply intertwined with societal structures, and it's time we understood why our current systems are failing the poorest and what we can do to fix it. Our journey begins by understanding the deep roots of inequality in health. It's not just about access to doctors or hospitals. It's about where you're born, where you live, your education, and even your race. These are what we call the social determinants of health. Consider this. Poverty is far more than just a low income. It's a lack of essential resources, from nutritious food and clean water to safe housing and adequate health care. Globally, over 40% of the world lives on less than $5.50 a day. In the United States, millions live in poverty, with the burden falling heavily on communities of color. This isn't a new phenomenon. Historically, poverty has been a major determinant of health, with centuries of systemic discrimination and historical injustices, like slavery and colonization, creating cycles of disadvantage. These cycles perpetuate health inequities that we see today. Adding to this complexity is the insidious role of racism. Both structural and interpersonal racism contribute significantly. Structural racism, embedded in policies and institutions, leads to discriminatory housing, unequal education, and biased justice systems. Interpersonal racism, through individual prejudice, further limits opportunities. Both create chronic stress and restrict access to vital resources for marginalized communities, leading to poorer health outcomes. The myth of meritocracy often blinds us to these realities, suggesting success is purely individual effort. But this overlooks the profound structural barriers that prevent many from escaping poverty and achieving good health. Access to quality education, healthcare, and safe environments are not equally distributed, making upward mobility and better health an uphill battle for many. The impact of these inequalities isn't confined to national borders. It's a global crisis. The World Health Organization highlights that factors beyond the health sector, like lack of quality housing, education, and job opportunities, are often the underlying causes of ill health worldwide. Health inequities are literally shortening lives by decades. Imagine people in the country with the lowest life expectancy live, on average, 33 years shorter than those in the country with the highest. These social determinants of health equity often have a greater influence on health outcomes than genetics or even direct access to healthcare. The World Health Organization's 2025 report on social determinants of health equity reveals a grim truth. Targets set in 2008 to reduce gaps in life expectancy, childhood, and maternal mortality are likely to be missed. Inequities within countries are often widening. Children born in poorer countries are 13 times more likely to die before the age of 5 than those in wealthier nations. This isn't just statistics, it's millions of lives lost prematurely. Maternal mortality is another stark example. Despite a global decline, low and lower middle-income countries still account for 94% of maternal deaths. And even in high-income countries, racial and ethnic inequities persist, with Indigenous women, for instance, being up to 3 times more likely to die during childbirth in some areas. Gender inequality, including child marriage, further exacerbates these tragic outcomes. Economic inequality, structural discrimination, conflict, and even climate change are all key drivers of these deep-seated health inequities. Climate change alone is projected to push millions more into extreme poverty in the coming years. Furthermore, billions worldwide lack adequate social protection, like paid sick leave, directly impacting their health. High national debts cripple governments' ability to invest in these crucial services. So, what can we do? The good news is that solutions exist, but they require a comprehensive, multifaceted approach that addresses both poverty and racism head-on. It's about breaking the cycle and building a healthier, more equitable future for everyone. First, policy interventions are crucial. We need policies that promote economic justice, such as living wage laws, affordable housing initiatives, and expanded social safety nets. These create a foundation for better health by ensuring basic needs are met. Next, healthcare reform is essential. This means ensuring universal access to affordable, high-quality healthcare services, with a deliberate focus on the unique needs of marginalized communities. It's not just about providing care, but providing equitable care. Healthcare leaders and medical professionals can advocate for expanding health coverage and improving access. Community engagement is also vital. Solutions must be culturally appropriate and effective, which means involving communities in the research and intervention development process. This bottom-up approach ensures that interventions truly meet the needs of those they aim to serve. We must also actively combat racism. This includes implementing anti-racism training in healthcare and public health institutions, and actively working to dismantle discriminatory practices. Raising awareness among healthcare providers through cultural competency training can help reduce ethnic health disparities. Investing in the social determinants of health is paramount. Prioritizing education, housing, transportation, and environmental justice creates healthier communities from the ground up. Increasing health literacy in affected communities through targeted educational programs is another powerful tool. Finally, collaboration and tracking results are key. Healthcare facilities should partner with organizations working to address the root causes of health disparities. Monitoring and documenting program effectiveness allows us to learn what works and continuously improve our efforts. The public health crisis is a reflection of deeper societal issues. By understanding the intricate connections between poverty, racism, and health, and by committing to systemic change, we can move towards a future where health is a right, not a privilege, for every single person. Let's work together to make that future a reality.